Hello friends, good afternoon and welcome to EduSet Live Lectures. Dear friends, today in chemistry we will be talking about the concept of drugs and pharmaceutics. In that we will try to understand what are the drugs, their classification, as well as antipyretic and analgesics drugs. To discuss this topic, we have with us our subject expert Dr. Sushila Singhal. Dr. Singhal is Assistant Professor, Department of Chemistry in Deshbandhu College, University of Delhi. Without further ado, I would like to welcome ma'am to our studios and request her to start the lecture. Welcome ma'am.
Thank you, Amriji. Good morning, viewers. Today we are here to discuss about drugs and pharmaceuticals. Whenever the name of drugs comes into the mind, a picture comes of that person who are addicted to drugs. But is it this drug name is simple to that we are addicted to drugs? No, it is not this. In the daily life, we all are taking drugs, some in the form of supplements, some in the form of to get relief from some diseases or to cure some other symptoms which we doesn't feel that we are physically fit. So, in today's lecture, we will discuss about how drugs are classified into different categories depending upon their structure, depending upon their mode of action. And the different drugs, one of them is analgesics and antipyretic. So, starting with the lecture, we have divided our lecture into the two modules, that what is drugs, what are drugs and pharmaceuticals, how they are different from dietary supplements, and how these drugs are administered to our body, and what are the different effects of drugs, whether side effects are there, toxic effects are there or not, and what is a dose that is prescribed for a patient so that it will not affect our body. And then we will discuss about the classification of drugs, and in the second module we will discuss about some narcotic analgesics and non-narcotic analgesics and some individual members like aspirin, Phenacetin, Paracetamol, Phenylbutazone, Analgen and Ibuprofen. So, starting with the lecture, that what is a health? So, health is composed of three fitness parts. One of them is that we are physically well, we are mentally well and we are socially well. So, what is this physically well? That we are doing a physical activity, we are eating healthy food, we are getting a sound sleep. These all are connected to our physical health, and our mental peace also comes into the wellness of the health. And the third category is the socially well. A social health is the quality of your relationship with your friends, with your families, teacher and others, which are you are in contact with the other person. So, when we are not healthy, then it means that we are diseased. So, this diseased can be described as a departure from the normal state of health, that we are not physically well, we are not mentally well and we are not socially well. Now, if we are diseased, then we have to take some compounds which are known as drugs. So, these drugs and pharmaceuticals are basically the medicines which we generally take for the cure of our diseases. So, these drugs, the origin of this word drug, it is derived from the French word which is a drogue, which means a dry herb. So, in the ancient time, these drugs have been isolated from the dry herbs. The alkaloids, the terpenoids which were as isolated from the drugs has been used for the cure of the diseases. So, drugs or medicines are the chemical substances which are used to diagnose, to prevent and to cure the diseases, and these drugs can be natural, 25% from the higher flowering plants, 10 from the microorganism and minerals, and these may be the synthetic. A drug can be a simple chemical compound or it can be a combination of two or more different substances or different compounds. A substance which is other than food is known as a drug, which is intended to affect the structure or the functioning of our body. Now, the term comes which is the chemotherapy. What is this chemotherapy? It is the treatment of infections or diseases with specific drugs that destroys the harmful organisms with minimum or no toxic effects on the cells of the host is called the chemotherapy. It means we are using the drugs for the cure of our diseases, and using the chemicals is known as the basically chemotherapy. Now, the food which we are taking that also comes into the drugs. We have shown you some pictures. One of them is the vitamin E, this is the vitamin E capsules, and this is the vitamin B complex capsule, vitamin D also we have taken, and iron, and some more tablets. Are these supplements, they also comes into the drugs? No, they are basically the supplements which we can get from the diet also. So, these are the dietary supplements and which are different from the drugs. How they are different? Food are normally not considered as drug, but there are a group of compounds which lies on the borderline of the food and the drugs, and these are basically vitamins, these are proteins, and these are minerals also. So, first of all we will discuss about the vitamins which are required in the small quantity to carry out various metabolic functions of the body, and administration of these vitamins in a particular is particularly effective in curing certain diseases which are caused simply due to the deficiency of these vitamins. For example, the deficiency of vitamin C, it causes bleeding in the gums and the teeth, and vitamin D, it causes rickets in children and osteomalacia or osteoporosis in the adults. So, it is also a disease, but it can be cured by the diet supplements. So, vitamins act as drugs when they are used to relieve the symptoms of these diseases, but they are not as such, we can't say that these are drugs. Then comes the next supplement, which is the protein. So, deficiency of protein, it may also lead to certain diseases. For example, the disease kwashiorkor is caused by the deficiency of proteins due to its malnutrition. Similarly, we also require certain minerals in trace quantity, in minimum quantities, whose deficiency may cause certain diseases. For example, lack of iodine mineral, it results in the enlargement of the thyroid gland, and the disease is basically called as goiter disease. And you also have heard about the deficiency of iron mineral which causes anemia, and traces of copper, magnesium, and cobalt also, they are essential for the formation of normal red blood cells. So, these proteins, vitamins, and the minerals which are required in the trace quantities, these are the borderline compounds between the food and the drugs, and these are called as the dietary supplements, which are intended to provide nutrients that may otherwise not be consumed in sufficient quantities. So, these are generally the fatty acids may also come in these compounds, amino acids may also come, and fibers also. Then comes that how these drugs will be administered to a human body. There can be a number of ways via which we can introduce these drugs into the body, like orally. As a liquid we can take, which is also called as syrups in the scientific technical language, or we can take as a solid like tablets, and these tablets or these solids, they will be absorbed through the intestine. We can take the drugs topically, which are used in the form of creams or ointments. These drugs can be inhaled, which is breathed into the lungs in the form of aerosols or in the form of dry powders as a smoking substance. It can be injected as a solution, suspension, or emulsion either through intramuscular, intravenous, intraperitoneal, or intraosseous. Further, insufflation is another mode of administration of drug, which is snorted through the nose. These drugs can be administered via rectally, which is known as the suppository that is absorbed by the rectum or by the colon. Then one other mode is the bolus, which is usually given to raise the concentration of a drug into the bloodstream. These can be administered sublingually also, which is the diffusing into the blood through tissues under the tongue. And one other form of administration is the vaginally, which is basically as a pessary or primarily to treat the vaginal infection. So, these are the different ways or that how we will introduce a drug into our body. Then comes the effects of drugs, whether all drugs will only cure the disease or they affect our body also. So, drugs can affect the functioning of the body through side effects, through secondary effects, and through the toxic effects also. And what are these side effects? These side effects are unwanted effects, but often unavoidable, that occurs at therapeutic doses. It means the dose which is prescribed by doctors. For example, some of the anti-allergic drugs may also produce sedation. This sedation is a drowsiness. Some cough syrups also have this sedation effect. Then comes the secondary effect. These effects are indirect consequences of the primary action of the drug. For example, antibiotics, which are generally used to kill the harmful bacteria, they sometimes kills the friendly bacteria also, which also affects the functioning of our body. Then comes the toxic effects. These effects are the results of excessive pharmacological action of the drug due to the overdosage or prolonged use. For example, overdosage of paracetamol causes the liver damage, and overdoses of many other addicted drugs, they also causes the brain hemorrhage, brain damage, etc. Then comes the exact dose, which is called the how much dose is required to cure a disease, and what is the border of that dose is the lethal dose. It is named as a lethal dose 50. In toxicology, the lethal dose or LD is an indication of the lethal toxicity of a given substance or a type of radiation. The toxicity of drug is expressed in the terms of LD50, which stands for the lethal dose 50. It is defined as the dose required to kill 50% of the population of the test animal, and is expressed in milligrams per kilogram of the human body weight of the animal or a human body. Now, smaller the LD50, the lethal dose 50 value, the more toxic is the drug. Now, after discussing the dose, then we will come to the classification of drugs, that how these drugs have been classified into different categories depending upon similar chemical structures, the same mechanism of action, that is how these are binded to the same biological target, related mode of action, and that are used to treat the same disease. The World Health Organization, which is called as WHO, they keeps a list of essential medicines which are required worldwide for a similar disease. The Anatomical Therapeutic Chemical Classification System, which is ATC, the most widely used drug classification system, they assigns drugs a unique ATC code, which is an alphanumeric code that assigns it to specific drug class within the ATC system. Further, another major classification system is the biopharmaceuticals classification system, based on the solubility and permeability or absorption property of a particular drug. Now, pharmaceuticals or a drug is classified on the basis of their origin. On the basis of their origin from the natural origin, which are herbal or plant or mineral origin. Some drugs substances are of marine origin, for example, antimalarials. Drugs from the chemicals as well as from the natural origins, derived from partial herbal and from the partial chemical synthesis. For example, steroidal drugs. Drugs can be derived from the chemical synthesis only, for example, antipyretics. Drugs can be derived from the animal origin only, for example, hormones and enzymes, and the drugs which are derived from the microbial origin are called as the antibiotic. Drugs may be derived by biotechnological genetic engineering, and these can be derived from the radioactive substances. Now comes the classification which is based on the action. One of them is the antipyretics. The drugs which are used to lower the body temperature in a feverish condition are called as the antipyretic drugs. Few examples of antipyretic drugs are the paracetamol, crocin, combiflam, etc. Then the second classification comes as the analgesics. Drugs which relieves the pain are called as the analgesic drugs. For example, aspirin, ibuprofen, paracetamol also comes in this category also. Then comes the antimalarials. Antimalarials are the drugs which cures the malaria. Then comes the antibiotics. Antibiotics drugs are used to inhibit the growth of bacteria. These antibiotics are derived from the microorganism and they inhibit the growth of other microorganism. Then comes the antiseptics. Antiseptics are used to prevent the growth of bacteria near wounds, near cuts and the burns. Then comes the tranquilizers, which induces sedation by reducing the irritability or the mental tension. Some antispasmodic drugs are there which are used to treat the pain and the spasm in an irritable bowel syndrome, or you can say which are used to cure the stomach pain. Now we will discuss about the main classes, which one of them is the antipyretic and analgesics. We can club these two categories together. In the beginning, the naturally occurring plant products were discovered and used to relieve pain. Slowly, pure compounds from plant sources were isolated and identified with some analgesic action. Morphine is one of them. Morphine was found to possess such activity. A number of related compounds were isolated and used to relieve pain. With the development of the organic chemistry, with the development of the science, medicine science, synthetic analgesics which have the structure similar to morphine were developed. The first of such synthetic agents used in medicine were the salicylates. A large number of these medicines are in use these days. The most common are the aspirin, Phenacetin, Paracetamol, Phenylbutazone and Analgen, etc. Now we will discuss the antipyretic and analgesics separately. So what are antipyretics? Antipyretics are the drugs which brings about a drop in temperature in feverish conditions are called the antipyretic agents. A compound or drug which is antipyretic has in general an analgesic effect also, and vice versa. If it is an analgesic, it will also give the functioning of antipyretic drugs also. So during the use of several antipyretics, it was noted that some were excellent analgesics for the relief of minor aches or pains. Such drugs are therefore called as antipyretic analgesics. These are utilized today principally for the alleviation of minor aches and pains, but are also given along with the other drugs used for some specific ailments. Then comes the analgesic drug. An analgesic or painkiller may be defined as a drug which brings about insensibility to pain without the loss of consciousness. After taking it, one gets relief from the pain without any adverse effect. These drugs act in various ways on the peripheral and the central nervous system. Drugs which are used mainly for the other purposes but have analgesic action are not included in this category. In such cases, the analgesic property exerted may be a direct effect or indirect, but is subsidiary to the some other more pronounced effect. Example of these are sedatives, muscle relaxants and tranquilizers, etc. These cannot be called as the true analgesics, although they possesses the activity of reducing the pain to some extent. Then comes the type of analgesics. Analgesics drugs can also be classified into two main groups. One of them is the morphine and the related compounds, which are also known as narcotic analgesics, and the other one is the synthetic antipyretic analgesics, which are also called as non-narcotic analgesics. So first of all, we will discuss about narcotic analgesics. Compounds which produce narcosis along with analgesia are generally called as narcotic analgesics. Morphine is the principal alkaloid of the opium and is used as morphine hydrochloride and morphine sulfate. Both of these salts are white crystalline solids with bitter taste and are soluble in water. And this morphine is a powerful analgesic and is also narcotic in nature. Now, from where we get this morphine? Morphine is an alkaloid which is used as a drug, is derived basically, is isolated from the poppy plant seed. The seed pod of the poppy plant, it gives a milky substance which is a natural source of morphine and some other alkaloids also. When this milky substance, this white substance is dried, it is used for making opium. It contains the morphine, and this morphine basically is the drug which is derived from the plant, is used as a narcotic drug. It reduces the pain. this is the structure of, we have shown here the structure of the morphine alkaloid, the morphine drug. It depresses the central nervous system so that there is a increased tolerance to pain. It is also used to check peristalsis and for the suppression of cough and the relief of anxiety. This morphine is more effective when it is administered by injection than when it is given orally. So, if it is injected into the bloodstream via intravenous mode of administration, then it relieves the pain more effectively. The chief undesirable property of this morphine drug is that it causes addiction readily. Therefore, it should not be used only in those cases where other pain relieving drugs proves to be inadequate. For example, morphine controls pain readily caused by serious injury and migraine, etc. So, these are very chronic diseases. So, here only we can use the morphine. In other cases, we should use the substitute of the morphine drug. Like other opiates, morphine also causes slow breathing. It lowered heart rate, dopiness causes, it causes constipation, euphoria and itchiness also. Too much morphine can result in unconsciousness, cardiac arrest, suffocation due to the lack of breathing and coma, and even it can cause death of a patient. Then comes a codeine, which is a derivative of the morphine. This codeine is the derivative of the morphine. It occurs naturally in opium in small amount along with the morphine. However, it is obtained from morphine by methylating the phenolic hydroxyl group of the morphine. In the structure you can see that the hydroxy group of the morphine has been methylated to make the compound codeine. This codeine is a white crystalline powder. It is bitter in taste and it is slightly soluble in water. Usually it is used as the codeine phosphate, which is freely soluble in water. It is obtained by neutralizing codeine with the phosphoric acid and by precipitating the salt with the alcohol. The derivative of morphine, which is codeine, is much less potent analgesic than morphine. However, it is also used to suppress unproductive cough. Codeine phosphate is used as such or with some other analgesics also. It is the only natural product which is used in combination with some other synthetic analgesics also like aspirin and phenacetin. Some semi-synthetic derivatives of morphine and codeines have also been prepared. The acetylation of both the hydroxyl group of morphine gives diamorphine, which is also known as heroin, a well-known drug which is used as in its hydrochloride salt form. This diamorphine is more potent analgesic than morphine but has shorter duration of action. It relieves the pain for less time. Then comes the substitute of this morphine. Since morphine is an addictive drug, so we should use some other substitutes. Pethidine is one of them. We have shown you the structure of pethidine. This is a substitute of morphine. A number of synthetic analgesics based on the morphine model were prepared in attempt to find an efficient analgesic without the side effects of morphine. Pethidine is one of these substituents, although it is discovered accidentally. Pethidine is a derivative of piperidine. Chemically, it is ethyl 1-methyl 4-phenyl piperidine 4-carboxylate. Some of the scientists, they were finding some drugs which were efficient for the stomach pain, and they got this pethidine, which is a morphine substitute which is accidentally developed to reduce the pain. It is used in the hydrochloride form and it is a white crystalline powder with slightly bitter taste and higher solubility in water. It is used in place of morphine for the relief of most type of moderate to severe pains. However, its analgesic action is not as prolonged as that of morphine. It has also a mild sedation action. Pethidine is mostly administered by injection, although pethidine tablets are also marketed. Then comes the non-narcotic analgesics, which are also called as synthetic antipyretic analgesics. These synthetic antipyretic analgesics are used these days. These belongs to many groups. One of them is the salicylic acid derivatives. Aspirin is one of them. The second class is the N-aryl anthranilic acid, aryl acetic acid derivatives, aniline and para-aminophenol derivatives. Paracetamol and Phenacetin comes in this class. Pyrazolone and pyrazolidine dione derivatives, Phenylbutazone, Phenylbutazone and Analgen. These three drugs, they come in this fifth category of synthetic antipyretic analgesics. Now we will discuss all these classes one by one. One of them is the salicylic acid derivatives. Salicylates were among the first of this group to achieve the recognition as analgesics. Sodium salicylate was the first to be introduced in 1875 by Buzz. It is still used as an analgesic. Methyl salicylate, which is known as the oil of wintergreen, and phenyl salicylate, which is known as Salol, were then obtained synthetically, although not in use nowadays. Aspirin, which is a well-known antipyretic analgesic drug, which is known as acetyl salicylic acid, was first prepared in 1853 by Gerhardt. It was tested and introduced into the medicine as an analgesic by Dreser in 1899. It is the most important drug belonging to this group and is widely used nowadays. Here we have shown you the structure of aspirin. This is the aspirin, which is called as acetyl salicylic acid. This is the acetyl group and this is the salicylic acid. And this is the salicylamide. Salicylamide is another analgesic which is known as salicylene. This salicylamide is said to exert a moderately quicker and deeper analgesic effect than the aspirin. Additionally, some salts of aspirin are also marketed which possesses the analgesic activity. Few of them are aluminium aspirin. Here we have shown you the structure of aluminium aspirin. This is the aspirin salt which is complexed by the aluminium hydroxide, and this is the calcium acetyl salicylate, which is also known as the soluble aspirin. Although aspirin is insoluble in water, but when it forms salt with the calcium, it becomes soluble aspirin. Salicylate in general are found to have dramatic effect in reducing the inflammatory effect of rheumatic fever. So, in addition to analgesic, they also are anti-inflammatory drugs. Then second class is the N-aryl anthranilic acid. The search of non-narcotic analgesics led to the discovery of N-aryl anthranilic acids. These are primarily non-steroidal anti-inflammatory drugs which are also known as NSAIDs, NSAIDs, and possesses analgesic properties. Mefenamic acid is one of the important compound of this drug. The structure of mefenamic acid we have shown you. Its name derives from its systematic name, which is the dimethyl phenylaminobenzoic acid. The first letter of this compound, it gives its name mefenamic acid. It has been proved that mefenamic acid is somewhat superior to aspirin as an analgesic. This drug has a lower incidence of gastrointestinal bleeding than the aspirin. However, diarrhea, drowsiness, headache, vomiting, blood in urine, blurred vision, skin rash, itching and swelling, these are the side effects of these drugs. Therefore, it is used only in to a limited extent. Then the next class comes the aryl acetic acid derivative. Example of this class is the indomethacin. Structurally, it is 1,4-chlorobenzoyl 5-methoxy-2-methyl indole 3-acetic acid. It is widely used as anti-inflammatory analgesic in rheumatoid arthritis, spondylitis and osteoarthritis. It is also used to some extent in the gout. It is generally recommended for those patients by whom aspirin cannot be tolerated. Then comes the next class, which is the aniline and the para-aminophenol. Aniline, acetanilide, para-aminophenol, these are the derivatives of this class which are also given for the analgesic drugs. Then comes the pyrazolone and the pyrazolidine derivatives. Pyrazole is a doubly unsaturated 5-membered ring with the 3 carbon and 2 nitrogen atoms, and the derivatives of this pyrazolone and pyrazolidine, they also come in the class of analgesic drugs. One of them is the oxyphenylbutazone, which is also named as tendaline, is the metabolite of this phenylbutazone and is commonly used as an anti-arthritis and anti-inflammatory drugs. So, this was all about the classification of drugs. Thank you. Welcome back. After discussing the classification of drugs, now we will discuss some individual members of the antipyretic analgesic drugs. One of them is the aspirin. Aspirin is known by its trade names like Asparo, which is the 100% aspirin. Aspirin is also in the market in the name of Impirin, in the name of Ecosprin, etc. This aspirin is one of the most widely used medications globally, with an estimated 40,000 tons, which is a 50 to 120 billion pills of this aspirin being consumed each year. It is one of the WHO's list of essential medicines. It is a non-steroidal anti-inflammatory drug which works similar to other NSAIDs, but it is also having the antiplatelet effect and it suppresses the normal functioning of the platelets. Now comes the synthesis of this aspirin drug. Aspirin is synthesized by acetylating salicylic acid with the acetic anhydride in the presence of small amount of concentrated sulfuric acid. The mixture is then warmed into the water bath at about 50 to 60 degrees centigrade with the constant stirring. The contents are then cooled and are poured into the ice cold water, and then we get the fine crystals of the aspirin. The product is then crystallized from the non-aqueous solvents like ethyl alcohol. The acetylation of salicylic acid may also be accomplished by using acetyl chloride in place of the acetic anhydride. Here we have shown you the equation of the synthesis of aspirin. This is the salicylic acid. When it is treated with the acetic anhydride in the acidic medium, acetylation takes place at the hydroxy group of the salicylic acid, and we will get here the acetyl salicylic acid. The common name of this compound is the aspirin. Now comes the mechanism of the synthesis of this aspirin, that how the salicylic acid and the acetic anhydride, they react together to form the aspirin. The synthesis is acid catalyzed. First, there is a reversible reaction in which the oxygen of the carbonyl of the acetic anhydride is protonated. This increases the electrophilicity of the carbon on that carbonyl group of the salicylic acid. The oxygen of the phenol in salicylic acid then acts as a nucleophile, and that attacks the carbon of the carbonyl within the acetic anhydride, and it simultaneously breaks the pi bond of the oxygen. This then forms a tetrahedral intermediate. A series of proton transfer then occurs in between, and the electron on the oxygen of the hydroxyl group of the tetrahedral intermediate ultimately comes down and forms a carbonyl group. This simultaneously induces an acetic acid to leave, and after one additional proton transfer, the final aspirin is formed. Here we have shown you the mechanism in a equation form. This is the salicylic acid and this is the acetic anhydride, and this is the acidic medium. The acidic medium, first it protonates the acetic anhydride and it increases the electrophilicity on this anhydride group. Then this salicylic acid, it acts as a nucleophile and it attacks on the protonated acetic anhydride, and it forms a intermediate structure which is in a reversible rearrangement with the this next structure, then they loses the acetic acid and they forms the acetylation of this hydroxy part, and we gets here the acetyl salicylic acid, which is known as the aspirin. And this proton which is lost here, it will again recycles the reaction and we gets the aspirin in a more amount. Then comes the property of the aspirin. Aspirin occurs as the white crystals or the white crystalline powder. It is slightly soluble in water and is soluble in alcohol, chloroform and ether also. It also dissolves easily in glycerine. Solubility in water may be increased by using acetates or citrates of the alkali metals. This aspirin is stable in dry air, but in the presence of moisture, it slowly hydrolyzes into the acetic acid and the salicylic acid. Salicylic acid crystallizes out when an aqueous solution of aspirin and sodium hydroxide is boiled and then acidified. Aspirin is not hydrolyzed appreciably when it comes in contact with the digestive fluids of the stomach. On reaching the intestine, it is subjected to some hydrolysis. Aspirin has been shown to be extremely effective when prescribed with the calcium glutamate salt. The more stable calcium acetyl salicylate is formed then, and the glutamate, the calcium glutamate, this portion it provides a pH of 3.5 to 5 to initiate the action of this aspirin drug. Here we have shown you the calcium acetyl salicylate. Then comes the uses and the toxicity of the aspirin. Aspirin is one of the most important medicine in chemotherapy. Aspirin is an effective analgesic for acute pain, for antipyretic activity and anti-rheumatic agent, but is generally considered inferior to ibuprofen for the alleviation of the pain. It is a common remedy for the relief of headache, muscular pain and the toothache also. As with other NSAIDs, combination of aspirin with caffeine provides a slightly greater pain relief than aspirin alone. So, the combination of aspirin with some other drugs, it increases the efficiency of the aspirin analgesic functioning. The analgesic effect is even mild than that of codeine. However, it is most efficient in mild pains of the somatic region. In other combinations, aspirin, phenacetin and caffeine, which is also known as APC, is widely used. Also, combined tablet of codeine phosphate along with aspirin, phenacetin and caffeine are available in market. Aspirin is an important part of the treatment of those who have had myocardial infarction, which is a heart attack. After percutaneous coronary interventions, which is a PCI, such as the placement of the coronary artery stent, aspirin is recommended for those patients. Aspirin is thought to reduce the overall risk of both getting cancer and those which are dying from cancer. This effect is particularly beneficial for the colorectal cancer, which is the CRC. It may also slightly reduce the risk of endometrial cancer, breast cancer and the prostate cancer. Other uses, it is usually used in powder, in the capsule form or in the tablet form, as it is somewhat unstable in aqueous medium. There is some anesthetic action also when aspirin is applied locally in powder form in tonsillitis and in pharyngitis, and in the ointment form for the skin itching and certain skin diseases also. The dosage of this aspirin is 500 mg 4 to 6 times daily. In the usual dose, about 50 to 75% of it is exerted in the urine in the various forms in a period of 15 to 30 hours. Aspirin is generally ineffective for those pains which are caused by muscle cramps, by bloating and gastral distension or acute skin irritations. Effervescent formulation of aspirin, which is known as Alka-Seltzer or blowfish, it relieves the pain faster than aspirin in tablets, which makes them useful in the treatment of migraines. Then comes the salts of aspirin, that how the salts of aspirin they functions. Almost all salts of aspirin except those of aluminium and calcium are unstable for pharmaceutic use. The calcium salts, it appears to have fewer undesirable side effects and induces analgesia faster than its aspirin form. A common preparation of soluble aspirin, which is also known as Disprin, is it dissolves quickly into the water, into the aqueous medium, and it relieves the pain faster than aspirin itself. Calcium carbonate and anhydrous citric acid are present in Disprin, which makes aspirin more water soluble. When a tablet of soluble aspirin is put into the water, the citric acid, it reacts with the calcium to form calcium citrate solution, and this dissolves the aspirin to form calcium acetyl salicylate. The reason for this approach is that calcium acetyl salicylate is hygroscopic and it must be protected effectively from moisture to avoid its hydrolysis. Then that how this aspirin it attacks in body, how it's what is the mode of action of this aspirin. We are saying that this aspirin it is a anti-thickening agent in the blood. So, how the thickening of blood takes place? When the platelets are there in the blood, they produces the arachidonic acid, which activates the enzymes, which is the COX-1. This COX-1 it initiates the formation of thromboxane, which is a protein which initiates the thickening of the blood. So, when aspirin is administered to the body, this aspirin it blocks the production of this arachidonic acid. So, it blocks the thickening of the blood. So, it reduces the clotting and it causes the symptoms of the heart patients. Then in the blood vessels also, it also reduces the inflammation. Now, how this inflammation it starts? In the blood vessels, this arachidonic acid it activates the enzymes COX-1 as well as the enzyme COX-2. When this aspirin is administered in the body, this aspirin it inhibits the activation of this COX-2, which is basically starts the formation of neutrophils in the blood, which are responsible for the inflammation of the blood. So, it reduces the inflammation in the blood vessels and finally to the skin. Then comes a side effect of aspirin, that if we take a more dose of aspirin, that what will happen to a human body. Sometimes the swelling of eyes, face, lips, tongue and throat takes place. Ringing in the ears, sometimes loss of hearing takes place. In the lungs, wheezing, difficulty in the breathing, hoarseness, fast breathing are also the symptoms of the overdose of aspirin. Fast heartbeat is also the side effect of aspirin. Cold, clammy skin, sometimes it affects the skin also. High rashes may comes on the skin. And in the stomach pain, the heartburn, vomiting, bloody vomit can come. Vomit resembling coffee ground, like clotting of blood will take place in the stomach, and sometimes bright red blood in the stools also comes, and black or the tarry stools also come due to the overdose of the aspirin. So, these are the side effects of aspirin if we take in the more amount. Then the second individual member of antipyretic analgesic is the phenacetin. This phenacetin is the para-acetaminophenol, ethyl ether of this para-acetaminophenol. Chemically it is known as acetophenatidine or para-acetophenatidine. It occurs as a stable white glistening crystals or white crystalline powder. It is odorless and has slightly bitter taste. It is almost insoluble in cold water. It is soluble in alcohol, boiling water and chloroform, and it is slightly soluble in water. Then comes that how this phenacetin is synthesized. It can be synthesized from the para-nitrophenol. In this method, the para-nitrophenol is first converted into its ethyl ether, which on reduction will give the para-phenetidine, and acetylation of this para-phenetidine then finally will give us the phenacetidine. So, starting with the para-nitrophenol. We have taken here the para-nitrophenol, and first we will react it with the sodium hydroxide to make its salt, to make it easily available for the further reaction with the ethyl bromide for its alkylation, and here we will get the ethyl ether of this para-nitrophenol. Then this ethyl ether will undergo reduction with the sulfide and the sulfur, and we will get here this nitro group has been converted into the amino group, and we will get here the para-phenetidine, and then this para-phenetidine, it will undergo acetylation in the presence of acetic anhydride, and finally we will get the acetyl derivative of the para-phenetidine, which is known as the phenacetin. There is one another method of preparation of this phenacetin. In this method, the para-nitrophenol is first converted into the para-acetoaminophenol via the para-aminophenol. Then it is treated with the ethyl bromide under alkaline condition to give the final product. So, here also we have taken the para-nitrophenol. First it will undergo reduction, the nitro group has been reduced into the amino group. Then this para-aminophenol, it will undergo acetylation to give the acetyl product of para-aminophenol, and finally it will undergo reaction with the ethyl bromide, and we will get here the ethyl ether of the previous compound, and this is also known as the phenacetin. Then comes the uses of phenacetin. Phenacetin is an analgesic and antipyretic agent. It has no useful anti-rheumatic effect. It was an important ingredient of many analgesic mixtures used for somatic pain, usually in the combination with the aspirin, caffeine and codeine. It is used for longer period. It may damage the kidneys. It has been in use in USA for almost 125 years. Now its use is banned in USA. Phenacetin is converted into the para-acetoaminophenol into the body. It is probably the active analgesic substance and is now available as paracetamol. Now this paracetamol, whose prodrug is phenacetin, we will discuss the paracetamol, the main active component of the previous drug. Paracetamol, also known as acetaminophen or APAP, is a medication used to treat pain and fever. It is a metabolite of phenacetin that provides the analgesic activity. Chemically, it is para-acetaminophenol or para-hydroxyacetanilide. It is also the one of drug which is listed in the WHO's list of essential medicines, the most effective and the safe medicines needed in a health system. It is sold under the trade names of Crocin, Metacin, Calpol, etc. This paracetamol is a part of class of drugs which are known as aniline analgesics, which I have discussed earlier. It is not considered as non-steroidal anti-inflammatory drug because it does not exhibit significant anti-inflammatory activity. Then comes the synthesis of this important paracetamol drug. It can be synthesized from para-nitrophenol. Reduction of para-nitrophenol gives us the para-aminophenol. Since the amino group can be easily acetylated than the hydroxy group, the acetylation of para-aminophenol with one equivalent of acetic anhydride in the presence of aqueous sodium acetate will give us the paracetamol. Here we have taken the para-nitrophenol. First it will undergo reduction to make the nitro group into the amino group. Then acetylation of this para-aminophenol will take place and we will finally get the paracetamol. Now, what are the characteristics and uses of this paracetamol? It occurs as a white odorless, slightly bitter crystalline powder. It is slightly soluble in water and ether, soluble in boiling water, alcohol and sodium hydroxide solution. Since in our stomach we have alkaline medium, so this paracetamol, when it comes to the stomach, there it becomes soluble. Paracetamol has analgesic and antipyretic activities comparable to acetanilide. It is less toxic and therefore it is considered somewhat safer to use. Paracetamol is generally safe at its recommended doses, but if it is taken in a large amount or it is used for a long period, then it may cause some liver damage also. Skin rashes may also occur, and too high dose results in a liver failure. Then the next member of the antipyretic analgesic is the phenylbutazone. Phenylbutazone was used as a solvent for aminopyrine injections. In 1949, it was noticed that in patients with rheumatoid arthritis, better clinical results were obtained when aminopyrine was given by injections than by mouth. It was then tried alone and found to have some potent anti-rheumatic effects. It was also known as butazolidine. The structure of this phenylbutazone is the 4-N-butyl 1,2-diphenyl 3,5-pyrazolidine dione. So, this is the structure of phenylbutazone. Then now how we will synthesize this phenylbutazone from the malonic ester. Malonic ester condenses with the hydrazobenzene, which is 1,2-diphenylhydrazine, in the presence of sodium ethoxide to form a derivative of pyrazolidine 3,5-dione. Here we have shown you the malonic ester. This is the ethyl malonate. When it reacts with hydrazobenzene, the cyclization of these two products, adduct is formed in the presence of sodium ethoxide, and we will get here to the 1,2, this is the 1 and the 2 position, this is the 1,2-diphenyl 3,5-pyrazolidine dione. Now, when the substituted malonic esters are taken in place of the ethyl malonate, it reacts in a similar way, and for preparing phenylbutazone, we have taken here the N-butyl malonic ester. So, this is the N-butyl malonic ester, which already we have prepared from the ethyl malonate. When ethyl malonate is reacted with the sodium ethoxide and the N-butyl bromide, first it forms the N-butyl malonic ester. This is the N-butyl malonic ester. Now, this substituted malonic ester, it will react with the hydrazobenzene in the similar way we have discussed earlier. In the presence of sodium ethoxide, then the cyclization of both these product will take place in a addition reaction, and we will get here the phenylbutazone. Alternatively, these phenylbutazone can be prepared by treating 1,2-diphenyl 3,5-pyrazolidine dione with the N-butyl bromide in 2 normal sodium hydroxide at 70 degrees centigrade, and we can get in a simple reaction only by the alkylation of this ingredient will take place to give us the phenylbutazone. Then comes the characteristics, uses and toxicity of this antipyretic drug phenylbutazone. Phenylbutazone is a white to off-white, slightly bitter tasting powder. It has a slightly aromatic odor and is freely soluble in ether, acetone and ethyl acetate. Its solubility in water and alcohol is less. Phenylbutazone is used for the relief of many forms of arthritis. Its principal usefulness lies in the treatment of painful symptoms which are associated with the gout, rheumatoid arthritis, rheumatoid spondylitis and the painful shoulders. It acts more than an analgesic as it reduces swelling and the spasm by an anti-inflammatory action. The toxicity of this phenylbutazone is the initial, the therapeutic dose of this phenylbutazone is the initially daily dosage in adult ranges from the 300 to 600 milligrams, which is divided into 3 to 4 doses per day. This drug should not be given to those patients which have edema, which have cardiac decompensation, a history of peptic ulcer or drug allergy and hypertension. It should not be given to those patients which have symptoms of indigestion. Other common side effects of this phenylbutazone includes the gastrointestinal upsets with bleeding, with rashes, vertigo and insomnia. Visual disturbances may also occur in certain cases in case of excess use of phenylbutazone. Then the next antipyretic analgesic drug is the Analgen. Analgen is a derivative of aminopyrine. The trade name of Analgen is metamizole. Chemically it is sodium 2,3-dimethyl 1-phenyl 5-pyrazolone 4-yl N-methyl aminomethane sulfonate. It is white crystalline powder with a yellowish tinge. It is widely used analgesic and antipyretic agent, and the usual dosage of this Analgen is 0.5 to 3 grams daily in 3 to 4 doses. Then comes the synthesis of this Analgen. Analgen can be prepared from antipyrine, which itself is prepared by the action of ethyl acetoacetate on phenylhydrazine and the subsequent methylation of the adduct product of ethyl acetoacetate along with phenylhydrazine. These two ingredients, first it will make a cyclized product which is then acetylated, methylated to give us the antipyrine. Then this antipyrine, it can be converted to aminopyrine by the sequence of these reactions. The antipyrine, first it will react with the sodium nitrite in the presence of hydrochloric acid. So, nitroso group will be introduced in the antipyrine, then it will react with the zinc in the acetic with the acetic acid, and we will here get the amino antipyrine. The amino antipyrine then will undergo methylation to give us the finally aminopyrine. Now, Analgen is obtained from this amino antipyrine by its interaction with the sodium bisulfate complex of formaldehyde and subsequent methylation. So, here this is the amino antipyrine, it will react with formaldehyde and the sodium bisulfite, and it will make a salt of this amino antipyrine, which will then undergo reaction with the dimethyl sulfate, will undergo the methylation, and finally we will get here the Analgen drug. Then the next member is the Ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug. It is again a core medicine in the WHO's list of essential medicines. Trade names of Ibuprofen are Morphine, Nurofen, Advil and Neoprene. This Ibuprofen is marketed in the name of these drugs. Then comes the synthesis of this Ibuprofen. It can be synthesized by a boot synthesis. It consists of 6 steps, starting with the Friedel-Crafts acetylation of isobutyl benzene. Here we have taken the isobutyl benzene. When it reacts with acetic anhydride in the presence of aluminum trichloride, acetylation of the Friedel-Crafts acetylation of this isobutyl benzene takes place. Then reaction with the ethyl chloroacetate will give us the alpha beta epoxy ester, which is then hydrolyzed into this structure, and then it will react with hydroxylamine to give us the oxime, which is then this is the last with the previous structure. It will react with the hydroxylamine to give us the hydroxyl oxime, then it will convert into the nitrile product, and finally will give us the Ibuprofen. So, it was the Booth's synthesis. One more method of synthesis is the green synthesis. This synthesis of Ibuprofen is a popular case in the green chemistry. It involves only 3 steps. Here also we have taken the isobutyl benzene. It will react with the acetic anhydride in the hydrofluoric acid medium, and acetylation will take place. Then it will undergo reduction with the Rene nickel, and finally it will undergo carbonylation in the presence of palladium, and we will get here the Ibuprofen. Then comes the uses of Ibuprofen. Ibuprofen is used in the relief of symptoms of arthritis, fever, analgesics, etc. It is used as an inflammatory drug diseases. It is also used as pericardiasis. Ibuprofen is also known to have some antiplatelet effect, though it is relatively mild and somewhat short-lived when compared with the aspirin. It also acts as a vasodilator, having been shown to dilute the coronary arteries and some other blood vessels. Then there are some adverse effects of Ibuprofen. Drinking alcohol when taking Ibuprofen, it increases the risk of stomach bleeding, It elevates the risk of myocardial infarction, in particular among those which when it is taken in the high doses. So, this was all about the antipyretic analgesic drugs. Here are few questions related to these drugs which you can answer. Thank you.
Dear friends, due to paucity of time, we have to stop our lecture here. On that note, we would like to thank Dr. Singhal for coming to our show and delivering this wonderful lecture. And thank you, dear friends, for watching our show. Stay tuned and keep watching. Thank you.